the Odessa Brown Children's Clinic has been a staple in our community for more than 50 years. But did you know that OBCC also operates health sites inside 4 public schools in Seattle? Here to talk more about meeting kids where they're at is Nisreen El-Saadoun. And Nisreen is the school-based health program manager for OBCC. And thank you so much for being here.
Thank you, Kelly. It's great to be here.
Yes, this is such an important topic, but before we get started, I do want to mention there's a QR code right there on the bottom of your screen, and you can click that to support the important work that OBCC does in our community. So there it is for you. And now we'll get started. Back to the important stuff. Operating health centers inside these public schools is such an interesting idea. Why is this a model that OBCC has adopted?
Well, OBCC likes to take care into the community oftentimes, and school-based health is such an important model because that's where students, that's where kids are spending most of their day in school. And so this is really, it's beyond convenience, it's really about access. And so meeting families where they are and kids where they are is a big part of that.
Absolutely. And can you talk to me about the 4 locations and what kind of services they each provide?
Yeah, so we have a presence at 4 different schools in Seattle right now. We have a school-based health center inside of Garfield High School, Lowell Elementary School, Beacon Hill International School, and we have a care coordinator housed at Leschi Elementary. And
Fabulous.
Some of the services we offer are medical exams, well-child checks, vaccines, all the things that you would get from your primary care practice. We have mental health therapists at all of these sites.
Wow.
We offer nutrition counseling. There's community mental health workers there, dental screenings. We offer group education and in-classroom education as well.
That's so incredible to have, like you said, the opportunity that it's right there, you know, where the kids are day in and day out. So what are some of the biggest barriers that you think families are facing when accessing care?
A lot of our families experience barriers with transportation, language barriers. A lot of our families are experiencing houselessness. Recent immigrant populations are at a lot of these schools, families that are seeking refuge, that are new to the country. And so we know that a lot of these families may not have dedicated, established primary care or a dental home. And so this is one way of increasing the access to those important services for those families.
And do you think that's why these clinics are helping, just by obviously being right there front and center for them?
Yes, we try to meet them where they are, right? Absolutely.
Definitely. And OBCC, like you said, has been at Garfield High School for more than 3 decades. That's incredible. Can you talk about how that health center team has become such a big part of the school's community?
Oh yeah, we've been there since the 90s.
That is wild.
Yeah, staff. Some of our staff were students at Garfield.
No way. I love that.
I know, me too. And so, yeah, we work closely with the school admin, the students there. We want to understand what the changing trends are and what the needs are. And so we continue to have conversations with the school to understand how can we best show up for what you're seeing right now? What can we do to help support you the most? For example, last year when young Amar was tragically killed on campus, our staff were able to increase mental health therapists on site, social workers, community mental health workers to offer walk-in services if somebody just wanted to talk. Whether it was a staff or student, we were there for them.
That's so incredible. And how can the community, at large help support the Odessa Brown Children's Clinic?
Well, our mission and vision has been, since 1970, what Odessa Brown herself, was all about, and that was increasing access to health care for everybody that we saw, regardless of their ability to pay. So whatever their financial situation was, we want to provide them with the best care with dignity and respect. And so, community contributions help significantly with, furthering that mission and vision and that flourishing, allowing that drive to flourish. Ideas, having conversations allow us to be more innovative, which school-based health is essentially a very innovative approach, and it's, alone. And so those are 2 ways that can really help us grow. We'd love to be in more schools.
That would be huge. And I can feel your passion and excitement with this topic. So where does this passion come from, and why get involved yourself?
Oh, it's a huge part of my passion. For about a decade, I helped I helped with a community event in Seattle that allowed folks experiencing homelessness to gain access to healthcare. And then I ended up, getting my master's of public health and realizing that you can make a living out of this. You can actually do this for your work. And so it's always been something that I've dedicated myself to, but now I actually do it, for an organization. And so I'm very humbled and proud to be able to be in this position.
Well, we can all feel that. Thank you so much for being here today and sharing this important information. And don't forget to scan that QR code that you see right there on your screen to learn more about how to support the Odessa Browns Children's Clinic. And giving today actually helps ensure quality care with dignity for babies, children, and young adults in our community, regardless of their family's ability to pay.
This portion of New Day Northwest is sponsored by Seattle Children's.